United States. 2011 researchers were asking older adults a question that many people rarely associate with aging. When was the last time someone talked to you about sexual health or STI testing? It sounds like a simple question, but it revealed a much bigger problem because somewhere along the way, many of us were taught an assumption. STIs are something young people worry about. College students, people in their 20s, maybe people starting new relationships. But once someone reaches 50, 60, older, we almost stop talking about it. And research suggests that silence can matter. This is not the story of one fictional 52-year-old woman. We're not going to invent a patient and pretend her experience happened. Instead, this story comes from real interviews and published research involving older adults and women in the United States. And together, those experiences reveal something surprisingly human. Getting older doesn't automatically make conversations about sexual health easier. Sometimes, it makes them harder. Imagine what changes by midlife. Relationships can change. Marriages can end. People can become widowed. Some adults begin dating again after years or even decades outside the dating world. But there's one thing that may not return with them: the sexual health conversations they heard when they were younger. In 2011, researchers examining older adults' perspectives on HIV and STI screening looked specifically at barriers surrounding these conversations. Other researchers later examined what happens during routine health appointments. And again, an important question emerged. Are healthcare providers and older patients actually talking about sexual health? Because there can be an awkward assumption on both sides. The patient may think, "My doctor would ask me if this mattered." And the healthcare provider may think, "My patient would bring it up if there were a concern." So neither person says anything, and the conversation simply doesn't happen. That's where age can become misleading. Turning 50 doesn't create a biological shield against sexually transmitted infections. Being postmenopausal doesn't mean sexual health questions suddenly disappear. And looking healthy doesn't necessarily tell you whether testing may be appropriate. Some infections can exist without obvious symptoms. That's one reason screening conversations can matter. But there's another reason older adults may not think about testing. Pregnancy prevention and STI prevention are not the same thing. For younger adults, contraception may keep sexual health near the front of their minds. Birth control, pregnancy prevention, condoms, testing, doctor visits. But later in life, pregnancy may no longer be the concern it once was. And when pregnancy disappears from the conversation, sometimes protection and STI testing disappear with it. Researchers studying sexual health in adults 50 and older have repeatedly identified gaps in knowledge, communication, and prevention. A 2015 review examining HIV and STI testing among older adults found enough concern in the research to call attention to testing practices in this age group. Another review focusing specifically on older Black women examined HIV-related sexual risk after age 50. And research involving Black heterosexual women in the United States has shown how relationships, trust, communication, social expectations, and perceptions of risk can all influence sexual health decisions. That's important, because people don't make healthcare decisions like machines. They make them inside relationships, inside marriages, inside new relationships, inside complicated relationships. Trust matters, embarrassment matters, fear of judgment matters, and age matters too. Not because older women don't care about their health, but because society sometimes acts as though older women are no longer sexual people. That assumption can make an already uncomfortable conversation even harder. Think about a woman walking into a routine medical appointment after 50. Her blood pressure might be checked, her medications reviewed, her cholesterol discussed. Maybe someone asks about sleep, exercise, diet, cancer screening, all important conversations. But sexual health? That question can be skipped entirely. And sometimes the patient doesn't ask either. Not because she doesn't care. Maybe she simply doesn't think the question applies to her anymore. Research published in the Journal of Sexual Medicine examined sexual health discussions during periodic health examinations with older adults. the broader message is important. Sexual health remains part of overall health across the lifespan, not just during someone's 20s, not just before marriage, and not just while pregnancy is possible.